Hi, good afternoon, everyone. It's great to have so many folks on the phone with us today for this webinar. This is our quarterly forum with the leadership from Cabinet for Health and Family Services. And we're going to be going through a lot of updates with you all today. I know most of you are familiar with ThriveKY by now, but for those of you who may be joining us for the first time, our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And you can, if we click through here, you can see here are the principles that we use to guide our work. And these slides will be shared with you, so you can go through this later if you'd like. We'll click to the next slide. This is the list of our Thrive Kentucky member organizations, and all of these are live links if you want to learn more about any of our organizations. We always want to say thank you to our sponsors. We have a lot of webinars that we do and a roadshow that we put on, and all of that is possible because we have support from our sponsors to keep these programs free and to make sure that we're able to provide CEUs for certified community health workers, for licensed social workers. And if you haven't joined us yet on a roadshow, one of our roadshow stops, we would love to see you there. We do this in communities around the state because as much as we like to bring webinars to everyone, on a monthly basis with our state and federal policy updates and our forums with the cabinet, we also really value being in person in communities, learning from your experience on the ground, how things are working or not working in your communities, and how that can inform the policy advocacy work that we do. Let's go to the next slide. Oh, I thought we might have a roadshow slide in here. So we'll share that information with you as a follow-up to this webinar. We will send a follow-up with all sorts of good information. And that will include the slide deck and recording, as well as any materials that we discussed today in the chat and so on. So today we have a lot of updates for you on everything from childcare, Medicaid renewals, new Medicaid covered services, SNAP and P-EBT, DAIL, immunizations for back to school, a proposed Medicaid waiver to serve Kentuckians with serious mental illness, and a lot more. And we're going to fit all of that into 90 minutes. So it's going to be kind of a fast-paced webinar, but we'll try to cover as much as we can, and anything that we can't cover or questions we can't get to, we'll do some follow-up. And here to discuss all of these topics with us today, we are delighted to have with us Medicaid Commissioner Lisa Lee, Medicaid Senior Deputy Commissioner Veronica Judy Cecil, Director of the Division of Family Support Todd Trapp, Division of Child Care Director Andrea Day, Kentucky Department for Public Health Deputy Commissioner Dr. Connie White, Department of Aging and Independent Living Division Director Marnie Mountjoy. And hopefully I've covered all of our guests today. But we are really, really happy to have them with us. We think that these forums are a great opportunity to have more dialogue between cabinet leadership, consumers, and advocates. And we want these webinars to be an opportunity for you to get updates on our safety net programs, to share feedback with us and with cabinet leadership, and to ask questions. So during each section as we go, you can put your questions in the chat. We'll try to get to them as we go. And like I said, if we can't get to everything, we will do some follow-up. And so you see here the agenda that we have today. And I'm going to start by turning it over to Dustin to get us started with our discussion on childcare.
All right, well, that was a really illustrious list of government officials. I am not one of them. I'm Dustin Pugel, Policy Director at the Kentucky Center for Economic Policy. And yeah, we're going to start today with childcare, which is something that there's been a lot of discussion about in Frankfurt and in Washington, D.C., and for good reason, because childcare, as folks will hear over and over again, it's the industry that supports all other industries. So where we put our youngest kids while young parents are at work, it's also where a lot of the most important brain development for kids takes place. And at the very beginning of the pandemic, it was also an industry in free fall. Because we had to close so many doors and there were so many folks out of work, they couldn't afford it. And so what Congress did was provide really a historic amount of money to help stabilize the industry. And it really did that through 4 different rounds. The federal government invested over $1 billion into Kentucky, the largest chunk of which was the American Rescue Plan. Ever since 2021, we have been using that money for some really incredible improvements, both to our child care assistance program, but also to the physical locations where we send our kids, in the professional development of the caretakers themselves, in providing new locations for childcare by encouraging new providers to stand up family care homes and encourage businesses to create their own. And also by sending quarterly checks to every childcare, well, most every childcare provider in the Commonwealth. And all of that has meant that we've turned a page. We've really been able to stabilize the number of providers we have. We've been able to increase wages for childcare providers and so many other things. I'm not going to share a ton of details with you all on that because that's Andrea's job and she'll be able to talk about it much better than I will. But I will say that that money is coming to an end soon. A recent study from the Century Foundation estimates that about 1 in 4 childcare spots, which is about 41,000, as well as 1 in 4 childcare centers could close if that money isn't replaced through state or federal dollars. So it is I say that not to create panic, but just to say this is a big issue with big consequences. And we really hope that, and we're working for the General Assembly as well as Congress to recognize that and include that in their budgeting process. So today, Andrea is going to give us an update of all of that and more. And so I'm going to hand it over to her to give us a quick update.
Thank you, Dustin, for that introduction. And you mentioned the Century Foundation's recent report, and that was actually a topic of conversation this morning here in DC at the state administrators meeting, as well with the director of the Office of Child Care. So this isn't just a Kentucky problem or a Kentucky issue. It is a national issue that we're all facing. And the what's next is on the front of all of our minds. But to start my update, I want to share about the Employee Child Care Assistance Partnership. That was a direct result of House Bill 499, sponsored by Representative Hevrin in the last session. We lifted that program, started taking applications in April of this year. First payments went out in July. It has been a slow start, but we have had 104 total applicants, and that represents 142 children. Now, we've approved 60 of those, so that impacts 86 children. We've issued a little over $10,000 so far in our first payment, and those projections, the projection for the year for these folks is about $168,000. So obviously we have a large sum of money. The cabinet is going to continue to market this program. We are also looking at having some information at the state fair and thinking about how we can partner with some of our sister agencies in getting the word out, not only about the Employee Child Care Assistance Partnership, but also about traditional CHAP, the Child Care Assistance Program, because we have increased the eligibility threshold from, in the past 2 years, from 160% of the federal poverty guideline to 85% of the state median income. So that's a huge difference in those scales. And more folks are eligible now than they've ever been. And we are going to continue to try to promote that and recruit families, if you will, because the more families that we can serve, the better the Commonwealth, and that helps our providers for financial stability as well. The ECCAP, like I said, there were 60 approved, 44 have been denied. The biggest chunk of those were CCAP eligible families. So we referred them to CCAP because that benefit will be far greater, and they won't have nearly the contribution as a private pay family. So, you know, systems are working. We are working with our technology folks to come up with an online portal for year 2 and to take the lessons that we've learned from this rollout. We are also going to convene like an early adopter focus group to try to talk to those employers that have participated, have signed up, to find out what we could do better. How could we make this easier and less burdensome on their folks? And how can we make it more attractive for more folks to join? So we're really excited about that. And we've had the opportunity, the State Small Business Development Center, we've had the opportunities to speak with their group and to promote that. That was not on our list and they had no idea. So that was a way for us to say, this is 33% of this is devoted to small businesses. This is something that you guys need to be aware of as you're preparing these small business owners for new endeavors, especially whether it's childcare or any other, that this is an option for you and these funds are there for you to use. As Dustin mentioned, our ARPA funding is coming to an end. We had $470 million that was dedicated for stabilization payments, and the cabinet, we decided to issue those quarterly beginning in November of 2021. And there's 9 quarters total. We have paid out 8 of those quarters. The 9th and final ARP funded stabilization payment will be issued in September. I can say that when we initially developed this plan and budgeted for this, we had put a little bit more into administrative costs that we have not used. So this last payment will be a little larger than anticipated. We don't have the exact numbers yet. We're still working on that, but providers will see a little extra funding in that last ARPA stabilization payment. So we are excited about that and we'll be releasing information about that soon. The other things that we've done with ARPA funding, we have, like I mentioned earlier, increased the eligibility threshold up to 85% of the state median income. So far, that has benefited almost 5,300 families and almost 7,800 children. So that's huge. And that really helped us get back to our pre-COVID numbers of the families we were serving on CCAP. We also started transitional childcare as a way to mitigate the cliff that families face. We used ARPA funding to pay 50% of a family's childcare rate for 6 months. That way it gives them time to absorb the full cost of childcare into their household income. So far, that has benefited 1,200 families, about 1,750 children. That provision, we will need state funding to continue that, because with the Child Care and Development Fund, we can't exceed anything over 85% SMI. So to be able to continue that type of program, we would need funding from somewhere else. We also increased the child care provider reimbursement rate. Historically, we've been on the low end of the spectrum, reimbursing providers at the 40th percentile of the market rate survey, which is essentially what private pay families can afford to pay. We bumped that up to the 80th percentile. And we hope to be able to continue that, because that is more money that the providers can use to sustain operations. And it's important to remember that while that is the cost, it does not come anywhere close to providing what the true cost of childcare is. There's so much more that goes into that. And as Senator Carroll said last week, childcare is not your typical business model. There's no fat left to trim for most of these providers. So being able to continue these initiatives are very important. Something that we're doing to help benefit families, we are paying, and providers paying on enrollment versus attendance, which is, again, what private pay families do. If you take a vacation, you're still holding your spot for that entire week, and those private pay families have to pay. With us paying based on enrollment, CCAP children are being paid in that same way. We're also waiving family co-payments. That is something that we use the CURSA money for, And then the secretary devoted funds for us to be able to continue that through the end of this year. We also have been providing scholarships to early care and education employees in licensed childcare, regulated childcare. We will pay their full tuition to get a credential, a certificate, associate's, bachelor's, or master's degree. So far, we have had 1,080 awards have been issued to 581 individual scholars. And 74% of those awards have gone to associate's and bachelor's degrees. And to be eligible for that, workers have to work 20 hours a week in a regulated childcare program. And by us investing, that is showing our commitment to, one, the professionalization of the profession. These aren't just childcare workers. They are teachers. They are providing quality care to our children day in and day out and preparing them for school, for life, for the workforce. All that starts early, as Dustin had mentioned. Brain development, 90% happens 0 to 5. And so if we're focused on K through 12, we're really missing the boat because it starts so much earlier than that. And we really need that investment early. Let's see here. The child care income exclusion is another provision that we have started. That is for child care employees who, again, work in regulated child care, can have their entire household income excluded from the CCAP application as long as they meet the CCAP requirements. Some folks like to call this categorical eligibility. Those are words we're not supposed to use when it comes to CCDF funding. So we call that a protected population. And that is a way for providers to have a recruitment and retention tool for their employees that they don't have to fund, essentially, because they can't compete with hospitality and retail and all those benefits. So this is a benefit that we're able to offer. And a lot of states are looking to us as leaders in that. Philip Smith will be presenting on it this week while we're in DC. And we've had a lot of other states reach out to us about how can we do this because we think this will work in our state as well. And we're talking bigger, I mean, Texas has reached out to us. So one of the larger states that we have. We've also offered a ton of startup grants because 60% of Kentucky's counties are childcare deserts. So we've really made that investment through grants to help folks open new programs. Our greatest success has been in the family childcare realm. We have issued 62 startup grants. We see this as a great opportunity, especially in our desert communities where childcare centers are not sustainable, but small family childcare homes can provide that service to families and be an economic and workforce support in those areas. I know that's a lot. I was trying to pack everything in. One thing I do want to mention is that there is currently a notice of proposed rulemaking in the open comment period from the federal government, the Office of Child Care, and that is to really help sustain and increase access to quality child care. The purpose of this NPRM is to improve child care provider payment rates and practices, which also increases parental choice, help stabilize providers, to streamline eligibility and enrollment processes, and just give a greater continuity of care to our most vulnerable populations. So there's a lot of moving parts. And as I said in the beginning, this isn't a Kentucky specific, this is a national issue. And, again, I'm in DC this week and I'm hoping to come back with a lot of innovative ideas that I can share with Kentucky and that maybe we can put into practice to continue the great work that the department has done over the last 2 years.
you did pack a lot in there, and I really appreciate it. And I think that's really a testament to like how much we can do with a decent amount of public resources. And just to sort of reiterate, you know, Andrea said that 90% of brain development happens from ages 0 to 5, 10% happens the rest of our time, and yet we only allocate less than $130 per student in state dollars for childcare, but we allocate over $2,600 for K through 12 education. So, you know, it's one of those make that make sense moments where, you know, we really give a lot of lip service to how important and how critical this service is, but we are not putting in the types of state resources that we need to be able to sustain the wonderful things we've been able to do over the last couple of years. So I really appreciate it, Andrea. We'll keep an eye out for questions in the comments. But at this point, I think we're ready to hand it off to Medicaid.
Thanks, Dustin. So we are excited to talk about Medicaid renewals. We are now, it's August 1st, so we're officially done with the first quarter of Medicaid renewals. They restarted back in the first month, was April with the first terminations for June. And now we are rounding out the third month of Medicaid renewals. So we're very excited to have Deputy Commissioner Veronica Judy Cecil here to talk a little bit more in depth about how things are going, what they're seeing. We know that the state has a great website that I'm sure that you will talk about a little bit more, that has a lot of great data on the website, but let's go through it. What has changed since the last time you were with us back in May?
Well, quite a bit. Thank you, Priscilla, for that, and happy to see everyone on the call today and engaged. We certainly have appreciated the partnership with a lot of the organizations that are on this call, and it really, without that support, you know, I think we'd be struggling more. But we remain concerned about the high number of terminations. We're just going to be candid and transparent about that, and doing all we can to try to ensure that there's no one terminated who is essentially Medicaid eligible, because primarily the reasons for the termination have been around no response, so they've not returned a notice. So we're, you know, this isn't not just a Kentucky issue, it's a national issue. All the states are experiencing very high rates of no response, which just, you know, prior to the pandemic, we obviously had some, but not to this degree. I do have, I always love slides with data, and we'll share these afterwards, but if I can share my screen, I will go through some of the information, because it just kind of makes it a little easier to understand. So this is a really high level across. We are in 4 months doing renewals over 4 months, because May's already come and gone, but guess what? We're still working on those renewals. Some of that is there were some pending tasks that we were completing. We've extended some members, and I'll talk about that in a little bit, to other months that originally had a May renewal date. People are, after termination, getting reinstated. So they come in after that notice of termination and provide the documents that we might need to perform that redetermination. So we do see what we are tracking is within a 90-day reinstatement, so they can, you know, if they're determined eligible, can get reinstated back to that original termination date, which is really great for making sure that if they've accessed services, those services are covered by Medicaid. So again, kind of tracking across the 4 months now. This is you all getting hot off the press data on the July terminations. Yesterday was the date. We're still getting some information in and still processing all that, but here's an initial look of what that looks like. I think, you know, our caseload did decrease in July and August. And the reason we did that, that you all might not be aware of, because I can't remember if I talked about it in May, but we have implemented continuous coverage for children. What that means is, as of April 1st, if a child new coming in or has been determined redetermined eligible, they get 12 months of continuous coverage. So the way that works is if there's a change in circumstance, that change won't affect their eligibility. There's only a few reasons why a child might be discontinued during the 12-month period, and that has to do with they age out. So they turn 19. They move out of state, or if there's a specific request by either a parent or a guardian to move that child out of Medicaid there's various reasons why someone may do that. So because of that, we did move a lot of cases to later on in the unwinding period if they had a child attached to it. And we did that because our system will be able to do that automatically, granting that continuous coverage. Right now, it's a manual process, and it's never good when it's a manual process. So we're looking forward to having that implemented in September. So you'll notice that July and August in particular, our caseloads are a little smaller, and that's the reason. And so the good news there is that it gives us our sister agency, the Department of Community-Based Services, our eligibility determinations, the ability to catch up from May and June because of a lower caseload. So it gives us a little bit of breathing room to try to make sure that we're staying on top of all those pending tasks that might be out there. So I'm going to talk about each of these months just at a very high level. I'm not going to go through all of this, but just to note a couple of things. And one is the data changes every day, because every day we're completing redeterminations. Every day a child is born, maybe gets added to a case. Every day, unfortunately, someone passes away, and so they're removed from a case. So it's really, I always give the caveat that this is a snapshot, and it is very much subject to change depending on when you're looking at the data, when it's pulled, what's happened since then. Even today, this morning, the data is going to be different than this afternoon. So just keep that in mind. But do want to point out that our Medicaid approvals have increased for May, and so that's always great. And part of that is part of that reinstated within 90 days. You'll see on the bottom right there, we've got 4,200 May renewals that have been reinstated. So they were terminated on May 31st. They were able to provide the documents we needed to make a determination or verification of information, and we were able to get them reinstated. So that's great. I mentioned the extensions. So we were approaching the end of May and very worried because we did have a lot of individuals who had not responded. CMS has given states some flexibility to extend certain populations in order to conduct additional outreach. So Kentucky is taking advantage of that, in particular for our long-term care and our waiver members. So if somebody is in long-term care or waiver, we are now extending them at least 30 days to conduct outreach. We've also been given permission to extend them one more month beyond that for a total of 60 days or 2 months, so that we can work with their family, their guardian, their facility to help complete that Medicaid renewal packet, get it back to us so we can perform a redetermination. Again, doing what we can to try to reduce the number of procedural terminations, especially if there's no response. So you will note in May, we did extend a little over 6,600 cases. Since then, we've processed 4,100 in June, and we extended, as I mentioned, for another month, some of those so that we can complete that. We do still have tasks pending from May renewals. That's that 66 number. And we prioritize those to try to get them worked as quickly as possible. But there's sometimes, there's a lot of back and forth. We might get information, it's not sufficient. We send out another request for information. So there's sometimes a lot of back and forth that goes with that. So looking at June, this again, approval numbers have come up, and we've already just from June have reinstated around 2,500 individuals. So that's great. You'll see that from June, we extended 9,700, a little over 9,700 total. Some of that includes those in June, from May that we extended 1 month, got extended a second month, but the total is 9,700. And then, as I mentioned, we have pending 537. Want to note something that I didn't note on the previous slide, which is we're tracking in terms of terminations, how many of those our system can determine is QHP or qualified health plan eligible. So our system can look at them, look at their income, and all the data that we do have available to us. We know they're over Medicaid federal poverty level eligibility, but that means they are more than likely eligible for the advanced premium tax credits and other ways of making that qualified health plan affordable. You know, in some situations, it's like at no cost to somebody. It will pay their premiums completely. So we're tracking that because we want to make sure if they're not Medicaid covered, they're covered somehow. And so we're really working hard on trying to get those folks connected to choose a plan, because they have to. They get transferred over to the exchange. They get told about this opportunity to choose a plan, but they don't get covered until they actually choose it. So it's a little different than Medicaid in that regard. So we're tracking that because we really want to see those numbers of enrolled folks increase. And here's a snapshot of July and August. We had not, you know, the previous slides, once the month closes, then, you know, we kind of turn to a full slide on the month. But here we still have July and August reflected this way. We did have 61% of our July cases that were passively renewed. That number continues to increase each month, which we're happy to see. In August, the number was closer to 70%. It was 69%. But as you can tell, in July, we are completing active renewals, and we'll continue to do that now, starting August 1. For anyone who was terminated, we'll now work them to try to see if we can get them reinstated. And then for August, we've already completed over 1,200 cases, and you can see the distribution between eligible and ineligible as we continue to work through those.
Wow. I had a really quick question,
sure.
just to jump in. For the folks that you extended for long-term care, what sort of direct outreach are you doing with those folks to make sure that they're, you know, going through the renewal process?
Yes.
Okay.
Thank you for asking that question. A couple of different things. So for the waiver members, we're reaching out to their case managers and asking them to make sure that they're supporting the member with completing the necessary documentation. And so there's a specific call to each case manager to do that. And then for the facilities, we are pulling the list and reaching out to the facilities to just see, you know, is there something we can do to help? You know, do you have too many cases and not enough people to help? Because that was a concern at the beginning of the unwinding, is that facilities felt like, oh, they've got these large caseloads now that they're going to try to help individuals with. Well, we've provided and offered to provide some additional resources to them to help, including, you know, picking up a family, having a connector work directly with the family to try to get that completed, where the facility doesn't feel like they have enough resources to do that. So it's direct contact with those support resources. And of course, we are directly contacting the member and or the representative listed on the member's file, so that we're talking directly with the family as well, or the individual.
Thank you. That's really helpful. Yep. I think that's one of the questions that we've gotten a couple of times from folks. So just knowing that y'all are doing that sort of direct phone call, let's go through this together, is really helpful.
Absolutely. Absolutely. Well, and along those lines, so outreach. By the time somebody reaches their termination date and has not responded, they've heard from us, from the state directly 3 times. We've called them or texted them or emailed them. Multiple modes of communication that we might have on file with them. We've tried to outreach to them to make them aware of the notice, the deadline, and to offer any support. If they're a managed care member, they've gotten even more contact because the managed care organizations are utilizing their texting and calling and emailing capabilities to outreach to their members as well. We've had members say, you've already called me like 5 times. But we just want to make sure we're reaching folks. It's a pretty important step to be terminated and to lose coverage. So we just want to make sure they know and that they're taken care of. And one of our other concerns is they receive the notice and just kind of automatically assume that they are no longer eligible just by receiving the notice to have to provide information. So we are encouraging members to return those notices with the information. Let us make the determination as to whether or not they're eligible. If we have a pending task as that termination date approaches and we cross over that date, we will not terminate them. We will keep them covered. And so it's, by at least responding, you get to hold your place in line and have us actually do a determination, which I think is better for everyone. And then, like I said, we're finding that there are definitely people that are no longer eligible for Medicaid. So we want to make sure they're connected to other coverage. And that gives us the opportunity to do that with more time once they respond. So as this mentions, for active renewal notices that were mailed, there's the dates for July and August. We again are really trying to be very intent on ensuring people have enough time and notice to respond and to provide information or documentation. So if they can't get through passive renewal, they get their request for information to give them that opportunity. And then lots of emails going out, and I will mention, we're very surprised at the low number of undeliverable mail. We're still digging into that. It's not just a phenomenon here, it's happening in a lot of other states. We're trying to figure out, is there something going on with the United States Postal Service? But once we do get a piece of undeliverable mail, we will immediately outreach by phone and other modes of communication that may be available to that individual to find out, are we able to contact them and have that conversation? So lots of outreach going on. This is just a snapshot of what their enrollment is looking like. So as you can see, we have had a dip. And we're just monitoring that very closely. Sorry, that's the caseload distribution. As I mentioned, we have a lower caseload for July and August. We'll have a lower caseload for November, December, having less work days, and then a larger number towards the end of the unwinding. And focused very much on qualified health plan and monitoring that, trying to get people enrolled. And so we're constantly tracking that against the Medicaid terminations. And yes, the website. So lots of information on our website. We are posting all of our stakeholder meetings. That's once a month. We had a special one involving the waiver providers, 1915C providers. That's on there. If you weren't able to participate in that, certainly go back if you're interested in what's going on with the Appendix K and the flexibilities ending there. But lots of information. We're trying to always provide updated information on there, and we welcome input and feedback. Especially around, is there a need for some type of education document, a flyer, some other resource like that? Happy to respond to that. And best way to track us is Facebook, Twitter, and Instagram. Like or follow us. We appreciate that. You don't have to do all 3, but do one just to stay on top of the latest and greatest for unwinding, that ongoing stakeholder meeting, of course. And then for providers reports. And I will say, so I was in a meeting with a provider yesterday, and I took advantage. I took advantage of the opportunity to ask the provider, "What are you doing for our members for unwinding?" And they were on top of it. Like they check the redetermination date in Kentucky Health Net. When the member comes in, they talk to them about when that date is. If it's a current date or the next month, they're talking with them, making sure they understand, look for that notice. Have you gotten a notice? If they've not, connecting them to appropriate resources. So, we're hoping that that's helping in some way.
Yes, this is all. Thank you so much for all of these great updates. I always love hearing directly from you what you guys have been working on. This is so helpful. Thank you.
Thank you. Thank you.
I think we need to roll on to the dental vision hearing regs. So we'll put Medicaid renewals on the back burner. But if anyone has any questions or stories, feel free to reach out to me. Feel free to reach out to Deputy Commissioner Veronica Judy Cecil. Any problems or cases that are coming up, please just let us know, and we're happy to help how we can. So now I'll turn it over to Kara to talk about dental vision hearing.
Thanks, Priscilla. This is Kara Stewart, pretending to be Emily Beauregard, per the little box. So just good luck keeping that straight.
And coming to you from our official office in the Capitol Annex.
Right. Yeah. And by official office, I mean, it's not, but
We're
yeah.
squatting.
We're squatting. So just wanted to say out loud that presumptive eligibility still exists, in case anybody tuning in kind of forgot about that and all of that conversation we were discussing. And then also welcome the secretary, Eric Friedlander, to our meeting. If you'll notice, he's also double dipping in a box. And we wanted to see if he wanted to say anything about the current utilization numbers around hearing, vision, dental, and/or Commissioner Lee.
I'm going to turn that over to Commissioner Lee. Hello, everybody. Just wanted to say hello. Normally, I think Carrie's on these calls, but she's on vacation, so you get me instead. I'm sorry. Also, just kind of backing up to the unwind for a second. I think it's important to know that as we look for who may have private insurance or Medicare, we've asked the MCOs to run those numbers on the folks who are losing coverage through Medicaid. That number looks like right now it's about 38% of those folks who have lost coverage have some other type of coverage. We're still confirming that, but it feels pretty right to us. We run our own numbers, they run their numbers. Their numbers are a little higher, so we're using theirs. So we're watching that as we go forward, because it's increased month to month. I mean, we started out around 28%, and this month we're at 38. I think like last month it was like 42% of the folks that lost. So it's an encouraging number. I hope that that's an indication of a good economy number. But we will see. That's good. And also in terms of further breakdowns, I mean, you all saw it's a whole bunch of numbers that we're trying to reconcile, and some of them do and some of them don't. And we're still working on a lot of that piece on the unwind side of the house. So no, we're continuously working on that. We found some glitches as we move forward, small ones. And so we just try to fix as we go. I like to say progress, not perfection. And we are able to live up to the not perfection part of that really, really well. And usually end up living up to the progress piece too. So with that, I'm going to turn it over to Lisa Lee, but I just want to say one thing. Thanks for your all's help on all of this. Oh, one other thing on unwind. One of the, and that's because you talked about presumptive eligibility, right? One of the pieces that we might have been able to, right, catch all those tenses, take advantage of. There's a presumptive eligibility piece that's a flexibility within the federal program, but we can't take advantage of it because of House Bill 7 of the whatever General Assembly that does not allow the Cabinet for Health and Family Services to do presumptive eligibility, but other folks can. So that's why it's helpful, but we can't. So there's a piece of that we can't do. So I just wanted to like alert there actually are real consequences to some of these things. So on dental, vision, and hearing, I've been around here since the glaciers first moved out of the state. And so this is something we've been needing to do forever, right? We'll pull your teeth, we won't fix them. That makes sense. You know, I couldn't work without these. I couldn't see my computer screen. So if like we're serious about getting people back to work, we're serious about really making an impact on people's lives. You know, dental issues lead to a whole host of other chronic conditions. Hearing issues clearly are tied to some of the dementia issues, Alzheimer's issues in the elderly, just because of social connection. The same can go for glasses. So there's so many pieces that I think this is something that we've needed to do for a long time. It's not very expensive. You know, it is not like I'd love to clear the waiver waiting list, but you know, that's not even a factor. That's all like a factor of 10 away from what we're spending on this dental, vision, and hearing. So sorry, I've talked too much. It's good to see everybody, and I'm going to turn it over to Lisa.
Hello, everyone. As the secretary said, there is a return on investment in our vision and dental and hearing changes. You know, our regulation was filed January 1st, with an effective date of January 1st, 2023. Since that date, we have seen over 40,000 individuals in the state of Kentucky, 40,000 adults get eyeglasses or some form of contact lenses to help them see. We've also had thousands of individuals get dentures. Hearing aids are the smaller number of services that we're seeing, but very surprised at the number of individuals who did not have glasses and now do have the ability to see much better and drive and even read applications and even read instructions for their medications. You know, there has been some confusion around the regulations because we filed their regulations that were found deficient. We filed additional regulations, and there's some question about the services, but please rest assured and let everyone that you know that the services are still available to individuals and should be provided to the Medicaid population. They will be available up until forever unless a bill is filed with the General Assembly in a future session to prevent us from delivering those services to adults. But we strongly believe that it's the right thing to do. As the Secretary said, it does help individuals get back into the workforce. Not only that, we know that we're spending $9 million a year on dental services in the ER. For adults, we know that moving these services to outpatient to offices, dental offices, are going to at least save $9 million. It's going to be a cost shift, move those individuals out of the ER and allow them to treat individuals with different emergencies. So again, the return on investment for these individuals getting a healthier life now and being able to remain healthier in their adult life is very good. And the other thing I would like to say before the Secretary jumps in again is that CMS has approved our state plan amendment to provide these services. So we are well within all of legal boundaries in delivering the services to adults.
The other thing we know, right? Dental pain is a gateway to substitutes, right? We know that. This is something we know. It's not a mystery. So these are really, really important services that have a direct impact on some of the challenges we see across the state.
And our regulations will be up, the ordinary regulations will be up for review. Again, we'll get that date out. Need all the support we can get to show the need for these services in our adult population so that we can continue to provide those, and that the legislators will see to it and agree that the benefits that we are receiving, a return on our investment, is well worth the small price that we are paying to deliver these services.
That date is actually August 8th at 1 p.m. So if you all want to come and weigh in. So again, currently, like Commissioner Lee said, these services will continue and it's been approved by CMS unless the legislature were to pass a bill saying otherwise. However, there is a public opportunity to weigh in to the legislature about how important hearing, vision, and dental services are. on August 8th at 1 o'clock. So with that said, I'm going to go ahead and let Emily share in my box. I feel like we're playing, what was that celebrity game? The, squares.
Hollywood
Go with,
Squares,
Yes.
Hollywood
yes.
Squares.
I feel like we're in very Hollywood Square life right now. We're like we win a grand prize if our lights up. So about community health workers.
I think the Capitol Annex is far from Hollywood, but yes, I like the squares. So we don't have a lot of time to cover, Medicaid reimbursement for certified community health workers, but I know this is something that, we've covered quite a bit during these forums and over the past years. We've been eagerly anticipating the regulation to come out, which it has. It's been filed and now it's active, it's in place. We have, in looking through it and in talking with some community health workers and others, we've identified, some areas where we think we need to make some changes, some concerns of ours related to, grant funding and the number of units per week and things like that, community-based organizations being able to participate. But those are things that we're having conversations about. I think that, what I'd like to hear from you, Commissioner Lee, is any thoughts that you all have now on making certain changes to the regulation as you move forward. And also just want to remind everybody that we are in public comment period. And so this is really the opportunity for community health workers to have a say in what this regulation looks like. This I consider a starting point and not the final product. And so we just really want to encourage everyone to weigh in. And we will be sharing comments with folks as we get closer to that deadline so that if it's helpful at all for you to use anything that we've put together. But Commissioner, do you have anything that you want to add here?
Oh, yes, thanks, Emily. We started allowing certain providers to bill for community health workers on July the 1st. As Emily said, the regulation is out for comment right now. We did do some extensive research, what we thought was extensive research, and we do know that there are actually kind of two community health models. One is providing services in the community that are not Medicaid billable, they're not medical in nature. And then the ones that within the Medicaid program that are billable are medical in nature. So trying to merge those two worlds and trying to figure out how each one has their own path, but also kind of coordinate with each other is a little bit difficult. So the regulation is out there. We are definitely going to consider all recommendations for our regulation. This, as Emily said, is a starting point. We know there are various different models out there, and really are seeking and asking for your input on some of the policies and the limitations, as Emily mentioned, that are in that regulation. And just please get your public comments into the department, even if you think it's something we may already know or something that just needs to be clarified in that regulation. Just please get those comments to us so we can take all of those into consideration.
Well, thank you very much. We appreciate you all working on this with us. And I am going to turn it over now to Dr. Sheila Schuster to talk about the 1915C waivers and the 1915I waiver and 1115 that are being developed now for serving people with serious mental illness.
Thank you, Emily, and thanks to you all. There's probably not been as much discussion about the waivers as there is right now. Some of it of concern because of the long waiting lists on the 1915C waivers. Those are the home and community-based waivers. And then the anticipation of the development of the 1915I waiver, which would provide supported housing and supported employment services for Kentuckians with severe mental illness. So I am very pleased to turn the mic over to Pam Smith, who is with us. She's the division director at the Department for Medicaid Services. And I think Pam is known as the guru of all waivers. So we're delighted to have her. And I wonder, Pam, if you could start with an update on the 1915C waiting lists and where we are with that, please.
Well, thank you, Dr. Schuster. So one thing I am very pleased to announce is that as of today, our HCB waiver restarted. So we were able to clear that wait list and allocate all of the individuals that had been on that wait list. It, as you all know, is our largest waiver. And I will say in the 20 plus years that I've been doing this, never thought we would get to the point that we had a wait list for that waiver, but our enrollment has just seen unprecedented growth, but I'm very excited. We were able to clear that wait list. We have a plan in place with some additional nurses that we are going to supplement our current assessor so that we can get assessments done for all of those individuals quickly so they can start receiving services. So that leaves us with our supports for community living and Michelle P waivers that continue to have wait lists. Want to remind everybody on the SCL wait list, the largest proportion of individuals on that are in the future planning category, which really means when an individual signs up for that, they're saying, I don't need services right now. My needs are being met, but I know sometime in the future, I may need those services. Being on that, in that category on the wait list doesn't necessarily mean they are needing services right now. Also, we did some recent statistics and found that 62% of the individuals on the SCL wait list are receiving services in another waiver, and 90-ish%, and I didn't write that number down, I'm sorry, of those individuals also have Medicaid eligibility, which means that they are able to access state plan services outside of the waiver. Now, so for Michelle P, which is our largest wait list, we are above 8,000 on that right now. 27% of those individuals are receiving services in another waiver. But another interesting statistic I wanted to share is that 50% of the individuals that we allocate, so we allocate 100 slots, only 50 of those go on to actually go through with the process of getting an actual level of care determination or receiving services. So 50% decline actually going on to receive services, which becomes, kind of a barrier to other individuals getting services, because there's that time delay, because we have to allocate the slot. We have to give the time to reach out to the individual. We have to give the time for, the individual to make their decision. So that's something that as we continue to look at the wait list and how we can refine those and how we can choose how we can begin eliminating those, is how do we address that fact that you have that high of a percentage of individuals that have signed up and said, I need to receive these services, that then go on to say, nope, you know what, I really don't want them, or I don't need them. And I think a lot of that is going to be through education. So, we continue to try to be transparent and to develop the education we have around the waiver. So that is something that we will continue to do with the waivers. But are there any other questions on the wait list before we move on to the SMI waiver?
Well, it certainly is good news that the HCB wait list is gone. And we knew that you had said that, I think, in testimony to the budget review subcommittee, that when the waiver opened up, and that waiver date was August 1st, so that was today, that wait list would be gone. I guess one of the concerns that we've had is that we assume that wait list is going to grow again if the waiver is not going to be opened up again until August 1st of 2024. What's to stop it from getting another 1,000 or 1,200 people on the wait list?
Nothing, Sheila. This is Eric. That is what's going to happen, right? And when budget time comes around, we'll request additional waiver slots, and hopefully we'll get them. But that is a very specific number that goes in the budget when we make those requests, and we'll do it again.
And I assume, since you're talking about the waiver, Secretary, that you're also looking at requests for budget allocations to reduce the waiting list of Michelle P and SEL? Is
We
that?
do every time. Yes, absolutely.
Yeah, and it seldom gets funded in the numbers that you have requested, is my recollection historically.
I don't ever remember it getting funded at the level we requested.
Yeah. And I think the long-term planning for families, I think one of the things that strikes me, Pam, about the 50% of the Michelle P saying no is, I think there's such a zeitgeist out in the public that the waivers are just impossible to get into. And so as young as a baby being born, say with Down syndrome, people are being told first thing off the bat, get signed up on a waiver because you're going to need it at some point. Would that be your sense as well?
I think we see that. And then I also think there's a lot of miscommunication out there on social media, or just perception in general that you need a waiver. I heard somebody say the other day, Michelle P fixes everything. You need to sign up for the Michelle P waiver wait list, without a real understanding of what that gets you and who, is that truly what you need? So it's really about trying to guide individuals to where the correct path is, what services do you actually need to access? Because a lot of these individuals have Medicaid eligibility and they could be met through state plan, but there's such a myth in this kind of lore that's happened around Michelle P that you need to have Michelle P. Michelle P is what you need to have, and that Michelle P is a different kind of Medicaid, and that there's a lot of misinformation out there that we constantly are trying to help re-educate. But I think there's a lot of factors that contribute to it. And so, we keep doing the best that we can to, as the secretary said, it's on my list that is one of my tasks I'm doing right now, working with others in the cabinet to determine that, what our request is going to be, and then just constantly trying to get the correct information out into stakeholders' hands.
Sheila, can I chime in? This is Tracy Brewer. I'm with the Down Syndrome Association. I'm a little confused on the last little bit of conversation there. So, Sheila, you are correct. When a baby is born with Down syndrome, we do say you definitely need to get on the Michelle P waiver waiting list. Why would we not say that?
I guess
Tracy,
the question is to you, Pam.
I was going to say, Tracy, I'm not saying specifically that you would not in those situations. A lot of times when it really is, if a child is born and has disabilities, and that in the future that they may have support needs, or that they definitely are going to have support needs, but we see it applied broadly where you even have a child that does not have a developmental disability, that does not have even a something that potentially would qualify them as needing those services in the future.
Gotcha. I'm sorry, Dr. Schuster, I may have misunderstood, but you used Down syndrome as an example, and I was trying to figure out if I was missing something and why wouldn't I tell a family that? So thank you, Pam. I appreciate it.
Yeah, I'm glad you clarified, because I was using that. You all have done such a great job at our 874K of getting that issue out about how long you are waiting when your kids are little bitty, and what the projected timeline is to get into a waiver. And certainly with the SCL, since it's the only one that has a residential option, there are people that predict that they're going to need those services as they move along.
Okay, I just wanted to clarify, because I don't want to do anything to bog down the waiting list. So I just wanted to clarify, because that is exactly what I tell parents with new families is you are going to need Michelle P. And if your baby's born today, the child will be probably 9 or 10 before they get it.
Yeah, I think that's right. Let me shift, Pam, for a minute about not just the waiting list, but we are hearing about people that have been on the 1915C waivers and now are being told that they're no longer eligible. that they're too severe, that their services cannot be met. And I'm
So
confused
if-
about that.
I'm aware of a couple cases, and in this scenario, I do not want to specifically address those individuals. I do know, there is a portion of the regulation that addresses that people have to be able to safely be served in the community. It could be, Dr. Schuster, that are those situations, but I don't want to speculate, and I also, and I don't want to share the details of the specific cases that I have direct knowledge of. I am more than happy to talk to anybody specifically if there's somebody that has that situation. More than happy. My team is to talk to anybody and to talk through that.
That would be helpful, and maybe you could put your, I think it's just pam.smith@ky.gov, right?
It is correct, yes.
Yeah, thank you, because we get those calls, the advocates get those calls, and I'm like, wait a minute, how is this happening? Somebody's been served on the SEL or some other wait list, and I mean, not wait list, but in the waiver itself. And they're not, suddenly it feels suddenly they're being told that they're no longer going to be served. And of course, families are extremely upset when this happens. And so,
Right. And absolutely. I have a great team behind me that has a lot of knowledge and that will work through that with anybody and answer any questions and figure out, what's going on or what miscommunication potentially has happened.
yeah, thank you. Let me shift in the interest of time to the 1915I waiver, which is the waiver for supported housing and supported employment for people with severe mental illness. And can you give us an update on that?
So we, as you know, have been working on stakeholder input. We've been working on looking at other states, kind of doing internal research. We just wrapped some internal design sessions between us and our sister agencies where everybody participated. And we are on target to, in 2 weeks, which those dates are about to go out with locations. And Dr. Schuster, I'll make sure I share that with you to share with Behavioral TAC. Emily, I can get that also to you so that you all can share those, where we will be talking about the 1915I. And certainly one of the big components of that is supported housing. And so there are 3 different levels of housing supports that will be included, as well as supported employment. And I believe there's 7 other services. Additionally, one of those being case management, which of course is critical to any waiver service. But our goal is once we have those town sessions, which really is a kickoff to public comment, we want people to understand, what the waiver is about so that they can have be informed when they read the waiver as it comes out for public comment, to make informed comments. We want everyone to really to promote people reviewing it, giving us public comment. That will be up for the traditional 30 days is what's required by CMS. We will then take 2 weeks to 30 days, depending on the amount of public comments we get to address those public comments. And then we'll be sending the waiver to CMS in late fall. So
I so applaud you for doing these town hall education pieces before the actual waiver goes out for comment, because I think it's very difficult for our family members and consumers themselves and others to read the legalese that is in those waivers and make comments. So I think having these, and I think you had mentioned at one meeting that there would be 5 in person and maybe 2 remote or something like that.
We are doing, yes, we're doing 5 in person that we have, and we tried to schedule them within driving distance of each part. So we tried to cover all of the state and be within reasonable driving distance, as well as we will do at least 1, if not 2 virtual sessions at the same time that we're doing the live session. And so we will record one of those as well so that it can be posted on the website so that individuals can go back and watch it if they are not able to attend any of the live sessions.
Well, for Steve Shannon had a conflict, but for Steve and me, who have been working for 20 years to get an SMI waiver, this is really exciting time, and we appreciate that process. Thank you very much, Pam.
Thank you.
I think Commissioner Lee, you wanted to make a comment about the mobile crisis state amendment having been approved.
Yes, our mobile crisis state plan amendment has been approved, and I think when we have the 1915 town halls, there may be just a little bit of information too out there about our mobile crisis intervention, because it kind of all goes hand in hand. But we did have approval for a mobile crisis intervention. I think this effective date, start date of those services will be September or October the 1st of 2023. So there'll be more to come on that information.
Okay, great. We're looking forward to that.
But it has to be a system, right? I mean, if you don't have the way to reach folks where they are, right? And I used to do some homeless outreach work in Louisville. If you don't have that mobile component, you got to have that as a front end, both for hopefully stopping people from getting, going to jail, ER, revolving door piece. But then you have to have some services like SMI waiver, right, for folks to actually get longer term services. So you gotta, if you don't put it together as a system, it's not going to work. So that's what we're trying to do within the limits of Kentucky budgets and right. CHFS, right? But that's what we're trying to do.
And then there will be some companion state plan amendments that come out too, as far as creating that full continuum. Those companion state plan amendments are behavioral health transportation specifically, and then a triage and transport state plan amendment, which will allow EMTs to treat on site, transport to a location other than a hospital. And there will also be the ability for EMTs to treat and not transport, because currently our emergency transportation regulations only allow providers, ambulance providers, to transport to a hospital. We believe those other flexibilities are going to help build that full continuum of care for individuals, so that individuals, particularly with behavioral health needs, can get those needs met outside of a traditional regular hospital or emergency hospital room. They'll be able to be transported to other locations.
And I think you had mentioned, Commissioner, that some of those teams would include a behavioral health specialist with the EMT.
Yes, the mobile crisis SPA does include a 2-person team that goes out, like a call can come through either 988 or 911. There's a 2-person team that goes out, and one of those individuals does have to be a behavioral health specialist.
Great. And that's a great segue to my friend and colleague, Marcy Timmerman, who's the Executive Director of Mental Health America of Kentucky, to talk about 988 and a celebration. Take it away, Marcy.
I'll keep it very short, folks, because I know we're short on time. But yes, 988 turned 1 year old July 16th. So let's just take a moment and to sink that in. Over 55,000 Kentucky-based callers have found support through 988 since its launch. That's just the data of folks that told us they were from Kentucky. So we're called from a Kentucky number. Some really amazing things. If you aren't familiar with 988, it is there for you for any kind of behavioral health crisis. So as long as everyone's medically stable, doesn't need an ambulance, please give us a call anytime you need some help. And it's not just for crisis moment, right? If you are wanting to prevent a crisis, or if you're observing one and you're a family member or a friend, it's there for you. So we just wanted to give a shout out to 988. Thank everybody on all of our call centers. We have 13 call centers here in Kentucky answering over those 55,000 callers. So major shout out to those first responders. Hope everybody will keep that in mind. Did want to note with Pam and Sheila, there are lots of questions in the chat. If you guys can take a minute to jump in there and answer questions about the waiver. But that's all I have. I am sorry, I don't have the agenda up. I don't know who's next, but whoever's next can take it from here.
We're going to turn it over to Jessica to talk about food assistance.
Thank you. Hi, I'm Jessica Klein. I'm a policy associate with Kentucky Center for Economic Policy. Again, I know we're a little pressed for time and have a lot to cover today. And one of the 2 things we wanted to cover in terms of food assistance was first getting an update from Marnie Mountjoy on the senior meals, since we know that we have a high rate of senior food insecurity. So that's something we definitely want to talk about. And then we'll hear a couple updates on SNAP and pandemic EBT from Todd Trapp with DCBS. So with that, I'm going to turn it over to Marnie to give us a little update on senior meals.
Thank you, Jessica, and thank you for allowing me to be here today just to touch base real quickly on the senior nutrition program in Kentucky. So that program is administered by the Department for Aging and Independent Living, and we provide meals to individuals who are age 60 or over. We have two types of meal settings. They can be home delivered meals, or they could be meals in a congregate setting, or a senior center. Senior center is what most people commonly understand to be those congregate settings. But we do provide meals to individuals who are age 60 and over. We also have a few special kind of caveats for people that are homebound that have a disabled adult living in the home with them. That person would also be eligible for a meal. We also have individuals with disabilities who reside maybe in a housing complex that's predominantly occupied by seniors. They would qualify for a meal as well. So we are very fortunate in Kentucky that we have been able to get some additional funding from the governor and the legislative body to support additional senior meals in Kentucky. So we call that the expanded senior nutrition program. So we receive about $13.5 million from the federal government, and then we receive about another $14 million from Kentucky to support senior nutrition. And last year, so for fiscal year 23, that's July 1, 2022 to June 30th, 2023, we provided 3.2 million meals in Kentucky. So this is a huge amount. We're very excited about all the additional seniors we've been able to support since we received some additional funding from the federal government during COVID, and then our additional ESMP dollars. So we do not have a waiting list right now for meals in Kentucky, which is very exciting. We administer our nutrition program through the 15 area development districts. So I say there's no waiting list. Sometimes you call the ad asking for a meal, and it may take a couple of days to get a phone call back. But in theory, there's no waiting list for a meal in Kentucky, and we're happy to support those that need a meal and getting a meal. So I know we're pressed for time, but I will put my contact information in the chat for anybody that would like some additional information on the Kentucky Senior Nutrition Program.
Thank you so much, Marnie, and congratulations on ending the wait list. That's a huge accomplishment over the past few years. Really appreciate all of your work on that. And with that, I think we'll turn it over to Director Todd Trapp to talk a little bit about SNAP. The first thing we wanted to touch on was the most recent work requirements within SNAP, known as the SNAP time limit.
Hello, thanks, Jessica. Yeah, I wanted to start by just explaining the difference. There's actually two different work requirements for adults in SNAP households. The first thing, when an adult in a SNAP household is applying for benefits, adults between the ages of 18 and 59 must agree to work register with or work register through the Kentucky Career Center unless they meet an exemption. And those exemptions are if they're working 30 hours or more, or the equivalent of 30 hours at minimum wage, if they're receiving unemployment benefits or KTAB, if they're the primary caregiver for a child under age 6 or a disabled person, if they verify regular participation in a substance use disorder treatment program, or if they are a eligible student enrolled at least half-time in training or higher education program, or if they have verified a disability or been determined through a field determination to be disabled by an eligibility worker. So that's one group. Basically, at application, if they agree to work register with the Kentucky Career Center, then once they sign that application, they're considered to be work registered. That's all they have to do. An additional requirement for a subgroup of that same group, and this is a slightly different age group. It's adults age 18 to 49 who don't have a child in the household. They also have to meet certain work requirements. And if they don't meet those, they can only be eligible, I should say, for SNAP for 3 months in a 36-month period if they are not meeting the work requirements. And those requirements are be working at least 80 hours a month, or participate in the SNAP employment and training program, or participate 20 hours a week in a WIOA funded program. So those are the work requirements as they exist. And again, currently the age member for that ABOD group is 18 to 49. One of the things that's changing effective September 1st, and it's going to be phased in, the first two age groups, the 50 and the 51-year-olds will become subject to those ABOD requirements effective September 1st of this year. And then effective October 1st, it'll be the 52-year-olds. Now I should rephrase that. The policy change is effective then, but it's going to be phased in over the next 12 months because it won't be a mass change. If it's an existing SNAP recipient who's newly subject to that, who's in one of those new age groups, they won't change. That won't become effective for them until they come due for recertification. So now, if it's somebody who applies after that date and is in one of those age groups, it will be effective for them at that point in time. Otherwise, it'll be that they won't be subject to that new requirement through the end of their current certification period. So, so that's the new age. And then the additional ages, 53 and 54, will be phased in the next 2 years. So 10/1 of 24, I think I'm getting my dates right, will be the 53-year-olds, and then 10/1 of 25 will be the 54-year-olds. So that's how those new age requirements will be phased in. The other change to the ABODs are, and this is a good thing, there are new exemptions. So essentially those exemptions I named off for work registration also apply to ABODs. And then one additional is if a female is pregnant, then they're exempt from the ABOD requirements. And then the three new ones are veterans are exempt, homeless, individuals experiencing homelessness, and then former foster youth. So if somebody's 24 years of age or younger, and on their 18th birthday, they were in foster care, then they are exempt from the ABOD time limits moving forward. Those exemptions all will be effective policy-wise 9/1 of September 1st of this year. And there will be two new questions in the eligibility system, one for the veteran exemption and one for the foster care, although we probably can identify most of them, but just to ensure we capture that, we're adding a new question. The homeless exemption, we already offer a homeless shelter deduction, so we're already capturing that information, and we'll use that question for the exemption as well. So that's the update on those. If anybody has any questions, they can send them to me, but in the interest of time, I'll move on. We got our P-EBT plan approved last week, so that's a big thing. And when I say that, it's for the school age kids, and then also the summer P-EBT. So school year is going to be this year's P-EBT for school age kids is going to require an application for the household, and the application for regular and private school kids begins, August 7th. And so this is for kids who missed, free and reduced price eligible kids who missed a meal during the school year last September through May of 23. And so they can apply. They'll need the number of days, the dates missed, the dates the kids missed school. They'll need the student ID for the student, and then some other identifying information. And this benefit will vary. It'll be based on the number of days missed, and that it'll be $8.18 per day missed. And so that application again begins August 7th. And then on a month later, right at a month later, on September 4th, the application will open for homeschooled and virtual students. So if a student was homeschooled or attending a virtual school because of related to COVID, then they can apply for benefits beginning September 7th. And all benefit issuance won't begin until, I believe, October, and then it'll run dependent as applications come in and are approved, will run until all those benefits are issued. And then summer P-EBT also, there's no application required for that. Enrollment for summer P-EBT is automatic for students who were eligible for free and reduced price meals as of May of 2023. So if they were eligible through the school year, as of May of 2023, they're going to be eligible for the summer benefit. One difference is this year, because of the ending of the public health emergency, the childcare age kids and homeschool and virtual are not eligible for the summer benefit. So that's one difference on P-EBT. And we got approval last week. I think we're expecting to issue a social media post later this week, so you all can watch for that. And on the EBT skimming plan, we still don't have approval for that. We got another round of comments last week. We're responding to those this week, and so more to come on that. And thank you all.
Thank you, Todd. I appreciate you going quickly through all those updates, and I know that we'll have more coming out on social media to see some specifics on those applications and things. So with that, I will turn it over to Kelly, who's going to help us stay on a few extra minutes to cover immunizations. Thank you.
Yeah, so we are almost at time, but this is being recorded. So if anyone does have to drop, we will continue to complete the update, and you can catch it in tomorrow's email when we send out a copy of the recording. So just to top it off, and I'm going to hand the virtual mic directly to Commissioner Dr. Connie White from the Kentucky Department for Public Health. Happy National Immunization Awareness Month. I don't think that's been said out loud. And so this is the space where I can comfortably say that and welcome you all to the space. I'm going to drop a few links in the chat while Dr. White is talking. One of them will be about our Thrive Kentucky Roadshow, the remaining stops for the 2023 calendar. The Immunize Kentucky Coalition is having an upcoming meeting. These are bi-monthly. We welcome you to join, as well as the public portal for the Kentucky Immunization Registry. We'd envisioned kind of showing you like a walkthrough, and I was going to bring it up and actually show you one of my daughter's immunization schedules, but we do want to push this as a resource because it is only as good as the information and use we put into it and out of it. So the more we can promote it among those that we serve, the better and stronger it will become. And so with that, I'm going to hand it over to Dr. White, who's going to talk to us about not only the current immunization schedule timelines for COVID-19, some of the more concerning ripples we're seeing with outbreaks and declining vaccination rates and what that means for rise of infection rates, reimbursement rate increases for pharmacists, and so on. So Dr. White.
Thank you so much, Kelly. I will still try to make this quickly done so people aren't sticking on too much longer. But I'll go over some things that I think are top of mind to people, and then I'll go into the dorky kind of public health stuff that's top of mind to me. But it is top of mind to you. You just don't realize it. So COVID-19, everybody's heard about this and figures that it's all over. Well, we are seeing nationwide increasing hospitalizations and rates. Nothing like what we saw in the past, but the question is, do I need to get a bivalent vaccine? Well, it depends. If you've not had one at all, I would definitely recommend that if you're going to be taking a trip and going to be in a confined area like a train or a plane. I think that would be a good idea, especially if you're immunocompromised, you're over 65, all of the things that you've heard before that put you at higher risk for COVID. We do know that we have no specific timeline right now, but we know that at the end of September, October, there's going to be a new COVID vaccination called the 23-24. I asked what that stood for. Duh, 2023, 2024. I thought it was some new variant that I didn't know about. But so the 23-24, we are hopeful will come out in September, October. At the same time, the flu vaccine will be coming out. So what we're hoping is that this will be part of your fall immunization routine where you'll get your flu shot, you'll get your COVID update, and that is the plan. As far as what HHS is, the Health and Human Services in Washington is hoping that every American should be able to receive this vaccine at either no cost or limited cost, and that depends on what your insurance covers. There's been a lot of confusion since the public health emergency ended back in May. So if you're getting a message that doesn't sound right, please check either with your local health department or with someone to find out if you're getting the right information, because I know some of the private pharmacies are getting things a little bit muddled. And so if you are being asked to pay a large amount of money, that is certainly something I would check with my local health department to find out what you should be covered for you. We do know that there's funding that we have at the health department. The 317 is what it's called, and that's for underinsured adults. We know that VFC, the Vaccines for Children program, will be covering COVID, and we also know that private insurance is supposed to cover this. So all of these things together should have you covered, whether you've got private insurance, whether you've got Medicaid, or whether you don't have any insurance. We have worked and are now, the pharmacists are actually getting paid a comparable amount to administer these vaccines. So we are hoping this will get more pharmacies to provide vaccinations, because they're open different hours than a regular doctor's office would be or provider's office would be. So that will give people some weekends and some late evening hours, because everybody works when everybody else is working, and you need that time so you can get those vaccinations. New on the horizon is the RSV vaccine, respiratory syncytial virus, which many of you heard of last year and maybe had never heard of before. But it can cause some pretty significant illness, especially in elderly and in young children. So that the ACIP is meeting at the CDC to make those determinations. They're also looking at a maternal RSV vaccine. So that way mothers, while pregnant persons can get that vaccination, so that they're not passing this on to newborns, which this can be a critical illness with them. So that's on the horizon, is a new vaccination. And then we've got our tried and true vaccinations coming up. There was a particularly nasty Southern Hemisphere flu outbreaks last year, which usually reflects what's going to happen in the Northern Hemisphere. And even though people say, well, we didn't have much of a flu outbreak last year in Kentucky, we had 10 deaths of children in Kentucky. That's a new record. So I think it behooves us all to realize that what we do or don't do affects what happens around us. And so I will definitely be encouraging you and your family and your connections, get that flu vaccine this year, even if you got one last year, because some of these children that died didn't have a flu vaccine last season, but they'd gotten it in the past. And so the family just didn't go back and get that last fall. And this was the outcome that they're living with, which is just beyond sad. We are looking at a pertussis outbreak in Kentucky now. I know there was some information in the Lexington newspaper about that today. It's a preventable infection, and so we're concerned about that. We're working with the school nurses, and we'll be working with KDE, what kind of information we need to get to staff and teachers. So if you have not gotten that, then if you have not gotten that vaccination, then you need to get that vaccination. We are working on hepatitis B. We're seeing a number of people refusing to let their babies be vaccinated in the hospital right after delivery, bringing them back a week or so later. So this is new, and ACOG, Kentucky National ACOG is working on programs to help train nursery nurses on how to counsel and inform patients about that. Talked about that. So we are just very hopeful that we can get the word out to folks how important getting their vaccines are. And as Kelly said, you can go, and the way I found it was I just Googled KYiR, Kentucky Immunization Registry, plus public access, and I got right to that. And I know Kelly's going to send that link, but it will allow you, if your provider entered your vaccination after it was administered to you, you can actually print out yours or your family's. Oh, good, great. Kelly's going to pull that up so you can see what it looks like. It's not really too awfully scary. First, last name, date of birth, gender, and your relationship. And then very important, it says, how would you like to receive this? You need to put the code in that was connected with when you got your vaccination. And so by doing that, yes, ask you. Excellent point, Emily. We've had providers contact us angry because vaccinations of their patients weren't showing up when they ran a report. And we asked them, well, when you vaccinate people, do you enter into the registry? And they say, well, no. It's like, well, we're not mind readers. You know, we have to have the providers enter that into the registry for you to be able to print that off. So thank you, Kelly. Here is her daughter's records right there, everything that any other provider would need to know. And it looks like she's a good mom, and her kids have gotten their roto, and there's COVID, and their Tdap, and so they've gotten the things that they need to protect them and to protect other people around them. So we think this is very important, and it took a lot of work to get this put together, and we are very proud of it. And we hope that the more people that use it and providers will use it, it will make it valuable to you, because who can find that little card that you got when you were 13 years old? Mine was mine was chiseled on a stone tablet. They didn't have paper back then, but it's hard to keep up with that as a busy family. So this gives you that opportunity to say, are we behind? Are we right where we need to be? You can look and see what might be missing and what that gap is, because you don't want to find out about that gap when you're in an emergency room or an ICU and trying to figure out what in the world is going on. So I will end this with our state epidemiologist has a sign outside of her door that says, got polio? And underneath it says, of course not. You were vaccinated against polio. Science works. So that would probably have to be my ending message. So Kelly, did we cover everything that we talked about?
You did great. You crammed it
Okay.
into less than 10 minutes.
Great. That was my goal. So if you have other questions, please contact Kelly. Has excellent communication with our immunization staff and with me. And so if you have questions, and I think there's some questions there. Okay, the public portal. No. Okay. So questions, please let us know. Information is what you need. And if you're empowered with that information, you can make all those correct choices for you and for your family and your close connections. And that's what we want. So thanks very much for including us today.
Dr. White, thank you so much for joining us and for rolling with this. You know how we always are. It's very hard for us to time this right, but we do really want to bring all these updates to community professionals and advocates who need them and use them in educating their communities and spreading the word about all these important programs and benefits. So thank you all for sticking with us. I really appreciate it. Like I said, there's going to be a follow-up with all this information. Any questions that we got in the chat, we'll follow up on. And we hope to see some of you in Moorhead in just a couple of weeks. We'll be there with our Thrive Kentucky Roadshow. I know Kelly put a link to that in the chat. You'll get a link to that in your follow-up email tomorrow, so don't worry about scrolling and looking for it. But we really appreciate you all being with us today. And we will see you, if not in Moorhead, next month. We'll have our state and federal policy update the first Tuesday at 2. and hope to see you then. Thanks so much, everyone.
Bye-bye.